As the World Health Organization holds its annual meeting, China announces a massive package of aid for developing world nations and pledges to make a Chinese vaccine available to the world. Are we finally turning the corner on the politics of the outbreak? And coming up later, as the Trump administration continues to sideline its own medical experts and scientists, the latest front in the battle in the U.S. seems to be between science and politics. What does that mean for the country in the years to come? Welcome to The Point, coming to you from Beijing. I'm Wang Guan, sitting in for Liu Xin. The 73rd annual meeting of the World Health Organization convened virtually on Monday. Chinese President Xi Jinping announced 5 concrete steps China will take to help the world cope with the coronavirus pandemic. He also said that China will support a, quote, comprehensive review of the global fight to COVID-19 based on science and led by the WHO. What do China's pledges mean to the global fight, and how to look at China's emerging leadership role as the U.S. threatened to withdraw its membership from the WHO? For some insight, I'm joined from Shanghai by Professor Chen, Executive Director of the Asia-Pacific Studies Center at East China Normal University. Via Skype, we're joined by Dr. Andrea Feigl-Ding, founder and CEO of the Health Finance Institute in Washington, D.C. And by phone, we have Mr. Jiyong, Associate Professor and Deputy Dean of the School of International Relations and Public Affairs at Shanghai International Studies University. Welcome to all of you, and thank you so much for joining us. Professor Chen, I want to start with you. China made very specific pledges, and that includes providing $2 billion over 2 years to COVID-affected countries, working with the UN to set up a global humanitarian response hub in China, making future vaccines available to the world. What do you make of these gestures and these pledges? Professor Chen.
Yes, I think actually for China, this is an important global, crisis that China is engaged in combating. China, as actually one of the countries that has been severely inflicted by the disease, is now actually, restarting its economy and actually getting the disease in control. So it is China's responsibility and obligation to engage itself, increasingly into the role to contribute to the final victory over the disease. So the global pandemic is a global challenge, and the virus obviously respects no borders. So China is pledging the contribution, and also China has been already, providing, PPEs and also medical facilities, as well as sending, teams of medical experts to various countries in the world. So all these are indicative of the increasingly active and prominent role that China is taking on the world stage to combat the pandemic.
Dr. Feigl in Washington, D.C., what do you make of China's announcements and its role in the global fight against the pandemic so far?
Thanks so much for your question. Thanks so much for having me. I mean, I think the pledge for the $2 billion can really be game-changing, because as we know, in developing countries, there's lower testing capacity, fewer intensive care units per capita, and often they're very crowded conditions. So, and we also know that the more earlier you act in a pandemic, the sooner you can control the virus. So I think that the leadership and the financial aid that China has shown is very, very promising, and also follows on the footsteps of other countries, and for example, the European Union and Germany and others pledging support as well. So I think it is really important, and as we know, and has been said, the virus knows no borders. So helping other countries helps us all.
Right. Mr. Jin, President Xi said China will set up a cooperation mechanism with 30 African hospitals to help with their preparedness, also working with G20 members on debt relief for the poorest nations. What do you make of these measures and these policy pledges?
I think those measures are very, very significant. Actually, those African countries, they suffer from the shortage of financial resources, and the infrastructure in public health is quite poor. As you know, both African countries and the countries in the world, other countries in the world, those countries, they are interdependent. So it's really impossible for China and other countries to successfully control the spread epidemic without a successful control in African countries. So those African countries are so vulnerable to the coronavirus. So it's really, really important for China. And of course, it's also kind of China has made such a huge commitment to have those African countries to combat the coronavirus. So I think it's quite significant.
Right. Professor Chen in Shanghai, regarding vaccines, this is what the Chinese president said. Take a listen.
COVID-19 vaccine development and deployment in China, when available, will be made a global public good. This will be China's contribution to ensuring vaccine accessibility and affordability in developing countries.
Professor Chen, what should we make of this pledge?
Well, I think actually the vaccine is the most important keystone to solve the problem. You know, the various countries are not now talking about alleviation of the situation, but actually until the vaccine has been developed, until the dependable, effective vaccine has been developed, we are not reaching the ultimate victory yet. So Chinese scientists and researchers are actually sparing no effort to develop and research for this vaccine, which is actually used for the global community. Mind you that actually you cannot restrict the therapy or vaccine within the borders of one country. That is definitely very parallel and self-interested, because actually, as we have been discussing, the virus knows no borders. So that actually, if you only, concentrate in one country only, but that will not solve the problem, because actually easily the transmission will be cross-border. So definitely, I think actually the Chinese pledge, President Xi's pledge, is a very important, indication of the sincerity of the Chinese willingness to commit itself to the global, combat against the disease, and also to ensure the final, victory over the disease.
Certainly, it is a global fight. It is a race against time to find a vaccine. Dr. Feigl, I want to ask you this question. We know that U.S. vaccine manufacturer Moderna said on Monday that the first coronavirus vaccine tested on people was able to safely stimulate an immune response against the coronavirus infection. Based on your observation, how far away are we from a vaccine that can enter the global marketplace?
Right. So I think the trial with Moderna has been showing very promising results in a very early phase. It's now critical that hundreds or thousands of people are being tested so the vaccine can be shown safe and effective. And if that pans out, maybe late fall might be a time when healthcare workers could, in phased approaches, receive the vaccine. And if that works well, potentially we're looking at early 2021, spring 2021 for a larger rollout. That being said, probably no single one manufacturer will be able to create the billions of doses of vaccines that are needed. So it's really a global effort and a race against time, because until we have that vaccine, we will still have to have different phases of social distancing measures and partial shutdowns of economies.
Well, I think it is today that the WHO scientists said that we should be prepared that the COVID-19 will be a constant challenge, a constant threat that we have to live with in the months to come. Do you think we should be prepared for that, at least mentally?
I think we should probably mentally prepare for the worst and hope for the best. Obviously, if some of the vaccines are successful, then with a phased rollout and concerted investments and advanced market commitments, there's hope, I think, for early 2021 or mid-2021. And then it will depend on the effectiveness of the vaccine, on other therapies and understanding, and the ability to also the supply and ramp up the supply and access and affordability. So I think the more investment there is right now in finding the cures and commitments to rolling it out and making it accessible to the majority of those who are in need of it, the sooner we can combat this virus.
Certainly, that is the hope of many. Also, in the speech given to the WHO, the Chinese President, President Xi Jinping, said China would support a comprehensive review of the global response to COVID-19 when the pandemic is over, in order to sum up experience and address deficiencies. This work should be based on science and led by the WHO. This is what the Chinese Foreign Minister said earlier.
China, together with other countries, has actively participated in the consultations on the draft and joined the consensus on the current text. The text of the current draft resolution calls on member states to take the necessary measures to prevent discrimination and stigmatization, combat misinformation and disinformation, strengthen cooperation in the development of diagnostic tools, treatment methods, drugs and vaccines, and discover the animal sources of the virus and review the WHO's response to the outbreak at the appropriate moment. All these are in line with China's position. The adoption of any resolution is the result of the joint efforts of member states, and the text should not be interpreted in an out-of-context and one-sided way.
Professor Chen, how should we understand China's position on a pandemic review, especially the Chinese position versus those reviews called for by the EU and the US?
Actually, initially, the United States and also Australia proposed this initiative about a so-called independent inquiry, in China, about China, about the origin and also spread of the virus, which actually should be excluding the WHO. That actually was definitely being opposed by China because it was politically motivated, singling out China to incriminate and frame China as actually in such a kind of kangaroo court. So actually the EU draft has been, the motion, have been drafted, along with other countries, including China, and this current motion, I think, is balanced and quite fair, and China is actually backing and supporting this initiative. It is definitely different from the initial initiative, proposed by Australia and the United States to incriminate China. I think actually it is going to be comprehensive, international, scientifically based, and also it is going to be conducted not only in one country but also on a variety of sports, on a variety of locations, including the United States.
Professor Jiyong, U.S. President Donald Trump said on Monday that if the WHO does not commit to, quote, major substantive improvements within the next 30 days, the U.S. will make temporary freeze, in terms of funding to the WHO. Do you see China filling up the vacuum of leadership when the U.S. threatens to withdraw from multilateral institutions such as the WHO?
Thank you for your question. Actually, the United States has already threatened and the United States already exerted some pressure on the World Health Organization to make some substantial reform. And so I think Donald Trump's speech, his Twitter campaign, I think it's a little bit ridiculous. It's impossible for WHO to launch substantial reform within 30 days. Actually, World Health Organization has launched reform since its establishment. So, for example, when Margaret Chen, when was the Director General of World Health Organization launched the reform. So it's impossible to launch such kind of reform. But anyhow, and the United States lost the leadership in the global collective action against the coronavirus. And China has made good contribution in the fight against the coronavirus. And China cannot fill the vacuum of the leadership. However, China can make a big contribution in the collective action against the pandemic.
Sure, indeed. It is the hope of many that China and the U.S. can finally work together on the global fight against this pandemic. Many thanks to our guests, Professor Chen from East China Normal University, Dr. Andrea Feigl-Ding, founder and CEO of the Health Finance Institute, and Mr. Jiyong, Deputy Dean of School of International Relations at Shanghai International Studies University. We'll take a short break, and when we come back, we take a look at the dangers of playing politics with science as the world battles the pandemic.